on a cellular level, we all age, get disease, and die from stress. Like, period, end of story, unless you die in an accident. Like, the root cause of death is stress, because stress, when you're in a sympathetic high beta state, you're causing inflammation over extended periods of time on a cellular level, right? And inflammation on a cellular level is what leads to all diseases. So it's like, okay, well, I know stress is the most crucial thing to grasp and handle. And as I started doing this research on HRV, I was like, wait, this is actually measuring your relationship to your stress, right? So heart rate variability is measuring the variance between each heartbeat, which indicates how your heart is managing its perceived changing reality. So essentially, your relationship to your stress, a snapshot of the health of your autonomic nervous system, which is the most important system that we still know so little about, governs 90% of your voluntary and involuntary functions, and its agility to go from a sympathetic, like stress, fight or flight state, to a parasympathetic, rest and digest, calm state, right? So I'm like, why? And I had an Oura ring at the time, and I saw the HRV on it. I know Whoop had it, but nobody was talking about like it. That you were more concerned about your readiness score, your sleep score, right?
Right.
It's like, how is nobody like, what is going on? This is the most important thing. So for the past 5 years, my intention in all the biohacking or anything I've done has been to like, I want to optimize this metric. In my opinion, it like just clicked. This is the most important metric. And so I've taken my HRV from when I started, the average nightly was like 32, to now like 160, 180. I've gotten 245 after like a medicine journey as an average nightly HRV, which people think are like freak numbers. They're not freak. Like, one of my favorite things about HRV is there is no range, right? And we love comparing and knowing, and like, there is no range for HRV because I believe there really is no ceiling, right? That's the other thing. You want a higher HRV, which is kind of counter. People think, no, you want a lower score. The reason you want a higher score is you want more variability between that heartbeat so that your heart is more malleable and can handle more of the perceived chaos that we are giving it every day, right? So the higher the variance, the more resilient the heart is, right? Think about it, like, you don't want a heart that's like da-da-da-da-da-da-da-da-da, because what does that mean? That's what happens right before you die, right? So you want that variability. And so it's important to not compare HRVs. This is an analogy I like to give, because you wouldn't compare two different languages, right? You don't compare English and French, and one is not better than the other. They're just different. And the intention of a language is for an ecosystem to communicate in, right? And HRV is a language in which your heart is communicating with you, your nervous system is communicating with you. And so your role is to listen to that language for your own body's ecosystem. That is it, right? And so what my opinion is it's more important to understand your baseline HRV and then get up in the morning and listen to what your nervous system is telling you did the prior day, right? And I define baseline, I'm launching a whole website about this, as your average HRV over the last 30 days, I think is a good indicator of, what, and it's changing every day. We talk like your HRV changes 40 to 60 times a minute, right? It's every heartbeat. So, and it's not just what you eat or how you work out. It's like what you see, what you listen to, your geographic location, the people around you. Every energetic thing in this quantum reality that we live in impacts how your heart is perceiving its environment, right? So it's a totality of everything, right? Which is why I find it like there's a lot of, very health conscious wellness people out there, but it's one metric that people haven't cracked yet, because you can't crack it by doing. You can't, you can support it with these things, but how you improve your HRV is, sleep is one of the most important things, right? We talked about that a little bit. And the reason for that is because when you're sleeping, you're in your deepest parasympathetic state, right? Your brain is actually oscillating in delta, which is 0.5 to 4 hertz, and that's like the deepest parasympathetic. Theta is that like meditative state between conscious and unconscious. That's when your brain is oscillating between 4 and 8 hertz.
That'd be like a Bikram yoga class, or
you could get
deeper.
To it in Bikram yoga. Usually eyes closed is more theta. So a savasana at the end of a Bikram yoga class, right? Bikram and like running or jogging or like an athlete in their flow state is known as the alpha state, which is a parasympathetic state. That's between 8 and 12 hertz. And that's when you're awake, you're conscious, but the monkey mind is off and you're kind of focused on one thing, right?
Gotcha.
Another great example of that is TV. That's why commercials are so good, because when you're in an alpha state, you're a sponge. You absorb everything. So they just hit you like 11 minutes in when they get you in the alpha state with a commercial, and boom, right?
Yeah.
And then beta is the sympathetic fight or flight state. And there are three different like levels. There's like low, mid, and high beta. And we are right now in a low beta state, which is healthy, but you don't want to be in a high beta state for too long, because I go back to evolution. We evolved creating this sympathetic state because we were living in nature, and there was a tiger that came in the middle of the day or even at night, and we had to all of a sudden like turn on and either fight, freeze, or run, right? So our body in this state takes all of our vital oxygen away from our away from the vital organs in the body and sends it to the extremities so that we could run or fight or do something, right? You're only supposed to be, well, we evolved only being in that for maybe an hour or two, and then we're safe and we relax, right? And it really clicked to me. I was recently in the Serengeti for the Great Migration, and seeing like the animals out there. They are in a rest and digest parasympathetic state 95% of the time. Right? Lions, literally, I didn't get to see a hunt, but like they're lying, relaxing all the time. The only time they're in that sympathetic fight or flight state is when they need to be, right? So we're animals. We evolved similarly until the Industrial and Agricultural Revolution, and the perceived stressful state when we get up and look at our phone or to work. So it's a mind-made now state that our body still reacts to as if we are dying, but we're actually not dying. And staying in that state from when you get up after your deep parasympathetic state of sleep till you have a drink after dinner or go back to sleep, day over day, week over week, month over month, that's what's leading to the inflammation on a cellular level that's leading to these chronic diseases and aging and death eventually.
Wow.
Yeah.